Sir, one question, sorry. For the fatty liver, sir, what if we apply castor oil pack in Edgar cases? Have you
Where?
in the liver region?
No, it apply.
No, sir. Edgar cases, castor oil pack.
Don't apply anything.
No external.
No external things.
Okay, sir.
This is also the serious case.
He was said by the famous MD physician, he will live only for 8 days. Huh? He was said to the patient was said he was not having more life. After 8 days he will die. Such a cirrhosis he was there. The patient's name is Kaundiram Gore, 40 years male, 48 kilo age, weight is was, living in Tambadi Roha. This case was came in 11 June 2024. See what is the history? 40 years male, history of chronic alcohol consumption, continue alcohol consumption. He never drink water more. Such much alcohol he drink. The symptoms of abdominal pain was there, jaundice, abdominal swelling, ascites were there, fatigue, loss of appetite. Upper abdomen was distended, dry cough was started, feeling sways were there, lower limb mild swelling was there on. Abdomen ascites with difficulty in breathing, epigastric pain in tenderness, upper area, upper abdomen tightness was there, and along with that nausea vomiting was there. His whole body was yellowish, full dark yellow skin was there, even this one, and constipation, anemia and weakness, this is a symptom. Before coming to me, he was last 3 months admitted in hospital for this liver cirrhosis, and he was taking allopathic medicines. He was having IV fluids, everything he was taking. And lastly, the doctor told that he will not live more, you take away home and you go back. We have tried many things, but he is not recovering. And he, in the hospital also, he was drinking alcohol, someone was providing him. See the maintaining cause. These are maintaining cause. Without removing the maintaining cause, we cannot treat any cases, even homeopathy can also fail. So we have to remove whichever the maintaining cause it is there, or whichever the obstacle to cure, whichever coming in the case now, we have to check first. Otherwise, we will not get results properly. What happens in fatty liver, alcoholic liver pathophysiology? Whatever the patient drink alcohol, 100% alcohol is absorbed by liver. 100% in alcohol cases. Whatever they drink, whichever alcohol they drink, 100% liver absorbs. Initially the swelling comes, then hardness started. Enlargement happens, accumulation of fat, steatosis in liver cells. Inflammation started, liver cells become inflamed, and later after enlarge, the liver gets shrink, which is called as cirrhosis, and the scarring tissue happens in the body. And because of that, most of the liver function get impaired, jaundice happens and ascites come, as no fluids are absorbed in the body, and along with that, pancreas and kidney also get enlarged. Many times liver and spleen are there, enlarged we can see. In jaundice, the dark yellow skin is there, and elevated bilirubin level more than 200, 400 we will see, and liver function disturbed, and portal hypertension there. Portal hypertension can also convert into thrombosis. It can allow and thrombosis also, and more accumulation of fluid. Then he was last 3 months, after 8 days they were removing 2 liter fluid daily. After 1 week they have to remove, tap the fluid, again the ascites comes and go. That same process they were doing last 3 months, and on that top he was drinking alcohol. Then they brought the patient to me. Huh? What is the main cause? Addressing the root cause is alcohol. Alcohol should stop first when we are treating such cases. Restoring the liver function by supporting detoxic and healing agent. Gentle individualized treatment based on totality of symptoms. Okay. What is the origin duration? He was admitted in last 3 months for alcoholic hepatomegaly, ascites. He was taking alcohol even in hospital last days. Then after stopping alcohol for a few days, suddenly withdrawal symptom came, and that hospital wale told ki you go away, we cannot treat the cases and you are not improving also. Then in 8 days you can happen, nothing can happen. As the bilirubin level was more than 23 or 28, more very high bilirubin was there, and AGPT values are also higher. Last 2-3 years he was taking the treatment with same doctor, and he was admitted also, but the hopes also not there. You go away from that, he told. And so they came to a Collard clinic. The physical symptoms were there: reduced appetite, dark yellow color urine was there, orange dark color urine, constipations, emaciation was there due to alcohol, and wasting of muscle. I advise him to stop alcohol first. Alcohol stop is very important. Or if the patient do not stop alcohol, Hahnemann sir has told, taper slowly. He is given in the chronic diseases also. Taper the addiction slowly. Sometimes withdrawal symptom can come, or either add Glucon-D in the alcohol, which will reduce the alcohol severity. When they have Glucon-D powder, whenever the patient drink alcohol, you add Glucon-D powder, and say to taper the alcohol in taper manner. In 8 or 15 days, in 1 month also he can reduce. If he is mentally prepared, he can reduce in 1 day also. You can stop 1 day also. Otherwise, you can put Glucon-D powder in alcohol glass and tell him to drink this only, which will not damage the liver. Which will not damage the liver. He can get the sensation like he is drinking alcohol, but the mild way. It is the better way to reduce alcohol in such a tapering manner. Or sometimes the patient comes suddenly violent, or withdrawal symptom comes to him. How we can diagnose this fatty liver test? Sonography is there, normal CT scan is there, or elevated bilirubin level, or AGPT, ALT or AST levels. These are the sonography reports. See, this 17 centimeter liver is enlarged. Gallstone is also there. Spleen is 12.8 centimeter. Urinary bladder thickening was there, and ascites also was there. Bilirubin level was 22 when he came to us, direct total bilirubin levels, and these were the medicine he was taking. See how much side effects may be happening. So last 3 years he was taking medicines with injectable medicines in hospital. Last 3 months, 12 or 15 medicines are there. Laciloctone were there, then what laxatives were there, liver tonics were there, and painkillers and all everything. Those common medicines were there, which he was taking last 3 months. Same medicines. And then also I stopped those medicine in day 1. Day 1, and alcohol also. I warned him. He was consciously at that time. He was not in drank position. I told him, you have to stop in now only, then I will recover you properly. I show the video. The totality of case or keyword what is the jaundice yellow color of eyes and whole skin yellow color. This is the marked symptom. Liver enlargement and liver with ascites. This is the main symptom for the entry. Group of the medicines: chelidonium, phosphorus, noxomica, arsenic, lycopodium. We can search also liver swelling or hepatomegaly or alcoholic liver. Those symptoms are available in search approved Mater Medica. They have given it. From that also we can search whichever the medicines come in, and because of that jaundice happens, or which are cause the jaundice happen, they have mentions. Alcoholic liver is there, hepatomegaly is there, liver swelling, the word is there, liver swelling. Then spleen enlargement is there. In that part also we can get in paragraph those all symptoms. and yellow eyes, yellow jaundice, and that symptom also will get liver symptoms. All the paragraph are coming nearby only. And we should read how the jaundice is, how the liver function is, how the skin color is of jaundice. From that also we can see. In Cheladonium, the word was there, dark yellow color eyes with whole body yellow. Obstructed jaundice it is called. Because of that, the color become yellowish. Now, dark yellow cannot become immediately. More obstruction is there, so I gave them Cheladonium. The medicine was 10 stroke, 40 drops and 50 ml water. I reduced the dose 50 ml and take 4 times a day. All medicines, 50 ml all medicine 4 times a day for the 10 days. After that, first follow-up, the yellow color of the skin, whole other part of the body get reduced. Yellowness eyes was also reduced, not completely, but the color was reduced. Swelling was there in ankle region and mild region, and face was completely reduced. Abdominal pain was gone, distension reduced, and dry cough. Dry cough was because of bilateral effusion, lung effusion was there. As ascites was happening again and again, the whole lungs were filled with the fluid, and heaviness were there while breathing, and over bloating sensation was happening in epigastric region. Those symptoms also reduced by Cheladonium. In general, he was better and he was eating more, which was not eating better way. He started eating normal foods last 4 days. And the relatives told what he had given. He is eating like many months he has not eaten, like he started hungry, eating appetite increase and weakness of better. And he started walking. He was having the habits of walking. Then regular he was walking for half an hour. And next medicine, within 10 days his medicine got finished 4 times a day. I started with Cheladonium 0.2 potency, 10 strokes, 40 drops, 40 ml water, and drink whole the water. These are the results of the medicines after giving. HB is 8.4, ESR is 135, CRP is 48.85. Bilirubin level reduced by only a little bit, 21.21, but the direct and indirect bilirubin level had reduced more as compared to the before one. So direct total bilirubin level will reduce. HGPT, HG will reduce. As the swelling goes, the baki symptom all will reduce, and the urine will become more yellow as the body excrete more and more bilirubin. So the symptom urine will become more and more plus. Later it will reduce also. The second video I will play.